Hello again. Welcome to our second episode, the Let's Talk Health and Social Care with My Work Mode. Today, we'll actually be interviewing the founder of My Work Mode itself, Tanya, and she'll be telling us all about the platform and, things about herself as well, like what inspired her to start in the care sector and what she really hopes to accomplish, beyond My Work Mode as well. So I'll be welcoming her shortly.
Hi, May.
Hi, can you hear me?
Can
Yeah,
you
I
hear
can hear
me?
you.
Yes, yes. I can hear you loud and clear.
Oh, wonderful. Okay. So welcome to the podcast with My Work Mode. You are the founder of My Work Mode, but this is the podcast itself. So it's our second episode, and I guess it's really a good idea for us to actually introduce My Work Mode on the My Work Mode podcast, right? So I'd just like to
Absolutely.
welcome you. Thank you for joining us today. And our first question is just going to be a little bit, more about you. Just introduce yourself and how you ended up in the care sector.
Okay, so hello everybody who is listening. My name is Tatjana, or Tanya for short, and I have been in the sector since 2000. How I got involved in the sector, it really was just by chance. I answered advert. They were looking for a recruiter in for doctors and nurses, and this is how I got introduced to the sector of recruitment. And obviously, I worked for about 4 months in that role, getting to know the ins and out of the working for an agency that obviously was placing doctors and nurses in the private hospitals and the NHS. And after about 4 months, I got approached and asked to manage a domiciliary care agency. And naive as I was, I took up on that role. And I'm not a care manager still. I was for about 3.5 years, and then I've changed my role um, for reasons that was one of the reasons that I actually created my work mode at the end.
Okay. All right. So it's a long trajectory kind of career path, right? So and it all
Yes,
accumulated in my work mode, which is,
indeed.
what we're talking about really today. So, we got the inspiration. You said that you were inspired to start my work mode because of the inefficiencies and inequalities you saw as, a manager and a recruiter and everything like that. So what is my work mode if you had to kind of explain it to somebody who had never heard of it before?
Okay, well, it is a totally new, unique approach to booking care shifts on demand without paying the high agency fees in the UK. Um, if you look at us, we are like an online marketplace that instantly connects the experienced, vetted, and rated healthcare workers with care providers and individuals at home whose own carers have let them down at the last moment. Our platform also allows booking to be made up to 7 days in advance if needed.
Okay. All right. So, but I see that I know there's a different approach. So it's different from a care agency in what ways? Other than I know there's like you can book the carers faster, right, on demand, which is
Yes.
hard. But that doesn't happen otherwise. You're waiting for a while. But what else is different?
Well, you're right when you say we are not an agency. We are different, though we might appear to be similar. But as I said, if I were to compare two of us, agency, for instance, charges such a high fees to both the clients who are using them and take a big chunk commission, sometimes up to 50% from the care workers, the ones who have been and done the hard work. We don't do that. We are unique that we ask our carers who come and join, obviously, on our platform to set up their own hourly rate, and they take 100% commission. So we're acknowledging that they're worth the hard work that they do. So we don't take any commission from them. Other aspect that why we are different from the agencies is that. On the contrary of them, our carers actually are already employed full time, and there is also a reason for this that I will explain a little bit in details more later. They work already full time, mostly some part time, and they can spare a day, possibly two during the week, where they can go in the locality where they live and hopefully support the local care provider or individuals at home when their own staff, obviously, as I said, let them down at the last moment. So they don't work for many places, or then just don't hop from one workplace to another. So hence the risk at the moment when we're talking about COVID is that they wouldn't be spreading it, because they would be employed full time, obviously. So that is the main difference between us and the agency. And as well, on the side of the client, we charge a much lower fee, up to 30% less than the standard agency would charge.
Okay, yeah, so it's amazing when you put it that way, right? Because it's obviously very different from an agency, even if it kind of provides, well, I mean, it provides a better service in a way because it's, faster. Um,
Yes.
and I mean, how are you, like, I'm just trying to compute if you're able to give carers 100% of their earnings and clients actually pay way less as well, what's the catch? Like, how is it able to do that? Why don't agencies do that? You know what I mean? Like, why do they take such a high commission from all angles?
Well, I think you need to ask them that question. But what I can say for us is that because agencies traditionally were probably for a long time the only solution that was there for the managers when they needed to cover their shifts, they use this position, and they charge a very high commission. So
So in a way, like,
and
they
they
have a
make quite a lot
monopoly
of
on
money.
it. Yeah, they have, like, a monopoly
Yes,
on
yes,
it, so, I mean, people have no choice, they
yes,
have to use it, okay. And I mean, on top of it, like, My Work Mode it's innovative as a tech platform, it takes out a lot of the middleman work, right? So I think, it's
absolutely.
sustainable on the end of the business as well, while also kind of connecting carers and
Yes,
clients without the high price tag. So, definitely a solution
yes,
that's like very much
absolutely.
needed in the current, I mean, pre-COVID climate in the care sector as well as the current climate, right?
Yes,
Um,
yes, yes.
so let's
I mean,
see.
I, if I would like obviously to explain a little bit why I created my work mode, and then obviously delve a little bit more deeper into the problems and issues and how we are solving those issues, and that will also compare us to the actually agencies,
Perfect.
and
Okay.
why are we different from this. So I mentioned at the beginning, obviously, that I've worked in the sector for the last 20 years. I was, as I said, initially in the recruitment, but then I moved to become a manager of the domiciliary care agency. And it is here that I've actually experienced firsthand those limited options that were available to me
Yeah.
as a care manager when the staff would call in sick. I mean, no
Mhm.
matter how well you would prepare the shifts in advance, the rotas, all it takes is, and this used to happen pretty much regularly every weekend, to receive a call or two that a carer cannot go to work, cannot come to work because they're ill or there are some personal problems. And I remember, obviously not very fondly, the hours I spent then chasing the carers, other carers, trying to plead with them to cover for the colleagues that they didn't turn up for work. And that just created a very, very stressful time for me, to the point that I actually wanted to leave the sector. But I didn't. I persevered. I stayed, and I moved in a different role, one that I saw as an opportunity to continue to support not just the carers but the care managers as well. I was delivering the training, their mandatory training, um, hoping that I can teach them how to become better carers. So, and during all this time that I supported them, and I'm still supporting them there, face to face, or now because of COVID, in a virtual reality kind of time when we deliver
Hmm.
the training, um, I've listened to them complaining that they are so undervalued, unappreciated, the carers. The managers on their side, they actually not getting the right support, that they don't have the right tools to for their staffing issues. And I realize, particularly in the last 3 4 years, this has gone so worse, and it's actually crippling the sector terribly. And it's probably one of the biggest causes why this staff is leaving the sector, which makes it even more troublesome. And this is all even before COVID happened. So after long thought, I decided that I wanted to address these issues and I wanted to help them. So this is how actually my work mode was born.
Okay. Yeah, no, it's all we've also talked to carers as well on the podcast and just in interviews and just hearing the level of what carers do. It's superhuman to a certain extent, like the hours and the job and everything, and just the level
Yes,
of underappreciation. And then there's like that missing link between care managers and them being able to do their job properly, and then carers as well just leaving the sector because it's almost at the end of the day,
yes.
is it worth the stress at that point, right? But
Yes, well, you're right. You're right in as much that the carers, as you said, that is the problem, that they're underpaid. I mean, today most of the carers are paid minimum wage, which is £8.70 in UK, and so it goes to say that they're probably on the lower or the bottom of the profession in terms of the payment. Yet their job role is so demanding. You are you're responsible for a human being and for their well-being. So it is so difficult and stressful on its own. So getting not paid right for this is one of the causes, as I said, that are making them leave the sector. On the other side, as I said, the clients who says that they are understaffed. And I think that in any given time nowadays, any days, we have about 80,000 unfulfilled shifts in the UK in the sector. So all these problems are huge. And as I said, so there are currently, obviously, there are some solutions there that the managers can look into it. We have the obviously the care recruitment agency, but they are very expensive. They are not instant. So I remember myself when I was trying to find a cover. That I would speak to an agency on occasion that I was given the green light to use them, and they couldn't find quick enough cover. So I had
yeah,
to go without.
and
So,
pretty
and
much
this is
by
the problem.
yeah, by the time they can provide you with somebody, you no longer need somebody, right? And then you're still paying for, yeah, like
Absolutely.
it's just that it
Yes, yes.
yeah,
And,
so
and
wow.
the other fact is that you often end up having a member of staff sent to you that you don't know much about it, just because they've told you that this person is qualified, that it is a very good carer. And then sometimes you get a person who just doesn't fit the team
Yeah.
because they're just not putting an effort into it, because that's how they were instructed by the agency. um, Other solution, obviously, is that, which is happening more often than anything else, is that you are pleading with your staff to put in extra hours. But on the other side, that causes them to burn out, to get ill. So it's like a vicious circle.
Yeah.
So there is there's other solution, obviously. There's a few competitors that we have there, and but if we look at each of them, they are just one-sided. So they either represent either look after the care providers but not the individual service users, or look after the individual service users but not the care providers. And we decided that both sides equally need our solution, so we actually covering all both sides. And obviously they are, as I said, one-sided. They also are not that instant. Some of them take commissions from carers, and they're also not that affordable. So, as I said, which is why when I decided to create my work mode, I looked in all those sides, and tried to bring a solution for everybody.
Yeah, and I mean, just also focusing on the carers themselves, everything you said about the competitors focused on the client heavily, which I mean, the client is important, of
Yes,
course. I mean, they need the service, right? But the carers themselves need to be respected and appreciated, right? That's what it all comes down to with them leaving the sector, and then you get, people who are not motivated and not happy in their jobs, so then that reflects on their work ethic, and it's just again, like you said, a vicious cycle, right? So just
yes.
to kind of clarify, carers are independent contractors on the platform, or are they employed by my work? Like, what's the agreement there?
No, they're self-employed. They're
Okay.
self-employed. We cover them for their insurance, so we're not asking them to be insured. We obviously want to invest in the best workers that they are. We have set some requirements that they need to meet in order to join us on the platform, and we intend to support them. We intend to, as I said, invest in them and give them 100% of their earnings, in a view that they then will be committed to come and to offer their services through our platform to everybody who needs it.
And definitely, I was looking through the platform, and you can see everybody's profile. You can see, once you want to book them, you can see what their skills are. You can see where they're located. Are they like close enough to you? So it's really good for both like client and carer in terms of being
Yes,
able to decide if it's a good or like a good partnership between the client and the carer, right?
yes,
Because a carer can also decline a job offer if they can't fit it into their, radius of travel or what have you, right? So it really kind of gives the
yes,
ownership to the carers and the freedom to the client to be able to book somebody pretty much on demand, without having to
yes,
wait for the agency to scramble and not find somebody
yes,
for
yes.
them, right? So overall, a better mousetrap is what I'm getting here, right? So,
Yes,
um,
yes, absolutely. As I said, our platform is set up by default to show you a radius of 5 miles only who is available, and as well all this information, a little profile about the clients, their experience, years of experience, their qualification is all is everything is there for the client to look at and decide who is the best fit for the job, for the shifts that they want to offer. And because they are local. Remember, we said about speed, instant, so we can
yes.
have carers pretty much within half an hour arriving at the place of work where they need to cover shifts.
Okay.
One thing
So,
that I want, sorry, one thing that I wanted to say as well, it's for which we are very proud, is that we have a social purpose as well. We acknowledge that we live in a society where we need to give back to the society, not just take out of it. So we are offering for charities and non-for-profit care providers. We're offering even further discounted fee, so they'll get over 50% savings compared to a standard agency's rate.
okay. Yeah, no, that's important too, right? Because I mean, all care homes from what I gather are on a budget for the most part, but charities and not-for-profits
Yes,
even more so. So that's something that definitely gives back to society and the community as a whole. So my remote's just overall a better mousetrap, and B also in it for the social causes and purposes. Which ultimately at the
yes,
end of the day, when you look at a company like that, it's really it's nice to see that there are companies out there that are created because of need. They come from need of something, but that they continue to stay focused on, you know, uh, being good, not just profit oriented, because those
Yes.
are the ones that really hit a chord with people, right? So, and
Yeah,
just kind of,
absolutely. I
yeah, go ahead.
sorry. Yes.
No, no, go ahead, go ahead.
Oh, well, I just wanted to as well say that, yes, I understand everybody needs to run a business, but we also need to look a little bit of, sort of how we're going to go and make the society a better place for everybody. So, I mean, in terms of, uh, we are so confident that we can actually achieve this, and because our mission is really to prove that care can work. I mean, so much so that we've put it in our tagline. So, and in terms of that, why we created and what is our vision with my work mode is to become really a first stop for providing instant access to professional healthcare workers for a fraction of the usual cost, making care ultimately affordable for all.
Yep, affordable for all and also worth it, for the healthcare. I mean, the provider themselves, the professional, right? Because they're not getting 50%
Yes,
commission ripped off of their pay. So it just kind of it
absolutely.
works and it continues to push, um, like an economic, just it's fiscally sound in a way. Not so much what's happening right now. Right now, the care sector has just been blood dry, I find, and everybody's scrambling. And then,
Yes,
the pandemic hit, and it just threw everything up in the air, and everyone was like, "Whoa, what do you mean the care sector was in such a horrible state?" Well, now there's a spotlight on it, and we can all really tell, right? So, um, now's the time for my work mode to
yes,
really kind of take the reins and shine, I feel. And I mean, that being said, it leads into my next kind of issue that I just want to tackle. So the government issued guidelines in the past stating that agency care workers were considered potential super spreaders, right? And I mean, it's like it's ridiculous when you think about it because so many things on that are so wrong. But I mean, how does my work mode as a platform mitigate that? Like, is there anything my work mode's doing to kind of, ensure the
yes.
safety of their care workers as well as their clients? Like, what's going on with that?
Yes, well, as I said before, we're different from the agency because, as I said, our carers, as I said, and the reason why we don't employ them or demand more of their time is because we wanted them to stay where they are because the sector is, sort of really, really understaffed with the workers. So, hence, they would be only working in one place and possibly one extra a day a week they could offer their services to other. The new things that we actually also introducing now on the platform is their COVID test. Obviously, COVID happened, and we needed to make certain that everybody is staying safe. And so our carers will be reporting their weekly test on the platform to show the dates when they tested negative. Obviously, if they're positive, they would not be able to set up their work mode on the platform.
Okay.
But we also thought that it's not just fair that the carers have to, sort of declare their negative COVID test. We also ask that the clients, when they book the carers, declare whether they have an active COVID case on the premises or whether they may be some inside the workplace or individual homes maybe have symptoms. So we again looked at both sides. It's, and because we thought that both sides really need protecting, so it is, and hopefully, as I said, that will reassure both clients and carers to accept jobs and to offer jobs to the carers.
Yep. That's perfect, right? Because once again, looking at both sides, it's not just the protecting the client side and demanding everything from the carers and like ripping money off their pay and saying, using them as a source for revenue essentially. No, you're giving them both, the kind of right to see exactly what they're going into, right?
Yes,
So yeah, again, that's a really good idea having the COVID test results being shown on the platform itself when somebody wants to go
Platform.
book. Um, and just kind of looping back a little bit back to the government, just the government itself, like, they'd issued those guidelines about the super spreaders, as like agency care workers. Like, do you have any just kind of thoughts about what the government's been doing when it comes to care homes, like their response to everything? Has it been sufficient, or are care homes and, care agencies and my work mode, are they getting the short end of the stick essentially?
To answer your question, yes. In whether the care agencies are getting the short end of stick in this case, and whether the government is doing right at the moment, no, or at the beginning. I mean, I understand that the COVID was new and it was shocking for everybody, but by now things should have been better. I mean, the idea that the carers are super spreaders because just because they work maybe in two places, but this is a very common thing in the sector. I mean, a lot of places, workplaces cannot offer them full-time positions, so according to the new suggestions of the government, they will stop the movement, that they want to bring a legislation to stop the movement of carers between two various care places. I think this will be just the final nail in the coffin, because I belong to various platforms where managers are discussing this, and it's frightening them because they nowadays, with every week, there is new change, new regulation, new guidelines. They just cannot keep up with all this, and they're so stressed. And I really despair when I actually read that they are at the end of their tether, and they're seriously after so many years in the sector that they want to leave because they don't know they will be losing staff. Not just that, they will staff will be leaving the sector because if they cannot get a full time position, or they cannot get a flexible working, because a lot of people go into the care sector because it does offer that flexibility. I think they would just leave, and that would be disastrous. I mean, I don't understand why do we put the care sector, on kind of on a lower pedestal than the NHS. I know we need to protect the NHS, but currently, I mean, the nurses goes between hospital as well. They do use agency staff because they are greatly dependent on agency nurses, and there is a clear evidence that the percentage of people that actually were infected while being in hospital treated for different condition is quite high. So I'm not really sure why we are actually putting NHS so high and yet pushing the care sector so low when they really should be on equal footing. So, and I think the government should go out of their way to help them, but not with some really unreasonable legislation that will actually, I think, just kill the sector altogether.
It'll hinder their ability to do their job. I mean, from my perspective, looking from the
Absolutely.
outside, right? I feel like care homes take care of a lot of people who might otherwise be in hospital, with their
Yes.
ailments or issues, whatever kind of care that they're, getting from the care homes that they have nurses at care homes too. They have, the carers administer medication. They're trained for it.
Yes.
So, um why you wouldn't put care homes and the care sector in general on equal footing as the NHS is beyond me. It baffles me, right? Because if they weren't there and if they're not supported and if they don't have staff, you really will have a run on the hospitals, COVID or not. They'd just be overwhelmed all the time? So
Ab- Absolutely, absolutely. I really don't understand their views, because I sometimes think that some of the ministers should really go and walk a day in the shoes of the care managers and the carers to actually get the understanding of the sector and how important it is for that continuous care of the patients that come out of hospital, and talking about the times when, sort of being not supported is, they released so many of the COVID positive patients into the care, and that actually was the reason why the COVID spread so quickly. Also backed up by the fact that they were not PPE, so there was no adequate personal protective equipment. There were shortages of it. So these are the two major causes of the such a high numbers of the COVID victims in the care sector, and not really the the idea that the government is pushing, that is because of the carers moving from one sector to from one workplace to another.
Yeah. No, this is the continual topics of this coming up with any carers we speak with, or you turn on the TV and you have it there as well, you know. Everybody in the care sector is saying this, like listen to us, and it just seems like they go and do the opposite when it comes to making legislation or making some kind of new guidelines, right? So, well, hopefully they do heed some, advice from the actual care
Yes.
sector, managers and, what have you. And, we come up with some kind of a better solution as COVID rages on. But, that just leaves me off with, kind of thank you for, you know, telling us more about my work mode and, explaining kind of the nuances of the care sector and how it's different from a care agency. And just, if there was a message that you could kind of just put out there, um, something about, yourself and your company to be known for, the bigger impact, the bigger picture that you want to make, what would it be?
Uh, well, as I said, I mean, our mission, I suppose, says it all. We want to prove that care can work. So we want to fix really the broken care system one shift at a time. So,
And like just on a even a broader spectrum, I know we had talked about it a while back. Nurses have like a register,
yes.
like a right, and carers don't. Why is that a
No.
thing? Shouldn't
Uh,
they kind of?
I
Yeah, go ahead.
Yes, yes. You mean make them equal as the nurses. I mean, nurses have to register. They as part of their registration, they have to maintain their qualification and their continuous professional development. Carers don't belong, I to any. So they don't need to register. So I think they need to create some sort of uh, it's a company that will actually system where they will be registering them, and they will be required to meet maybe yearly certain requirements to fulfill that and maintain a sector, so to be probably viewed as equally professional as at the moment they're viewing the nurses. So I think that might help a little bit, because the other things that I don't like hearing it about, that the carers are not skilled, they're being marked under unskilled workers. Well,
Yep.
again, wrong, because they do need to have quite a high skill to be able to perform their job.
Yep. No, I've heard politicians, newscast anchors, everybody, just say, "Oh, the unskilled labor force in care," and you're like, "Excuse me, have you tried doing this?" Yeah. They just
Yes.
assume, like I mean, there's hard skills and soft skills, and I find soft skills within the care sector are extremely undervalued. Empathy, patience, um,
Absolutely.
and these are not skills that people are good at. Yeah, a lot of the time. I mean, to be a carer and to be an exceptional one, to know what you're doing, it's hard. And it's skills that you develop through, whether it's apprenticeships or whether it's through doing certificates. And,
Yes.
so it's definitely, it's unfortunate that that's the viewpoint, and it needs to change, I think, from above. It needs to be, the whole perception needs to be altered. So,
Yes, absolutely, absolutely. I mean, to call them unskilled, it's just so unjust, because I deliver their mandatory training. I mean, it is so intensive. I mean, they have to cover so many subjects. They have to be kept up to date with legislation, with requirements, the standards and all that. And it is quite in depth. And so hence, somebody who doesn't know, calling them unskilled is just not right.
All right. Well, that wraps up, I think, all the questions I really have. A, about, my work mode, and B, also just some things touched on in the sector that kind of really, you're clearly passionate about. And, everybody should be passionate about them once they actually, they would be if they learned about it. And
Yes,
it's great to get that nice overview of, why my work mode was created, and what you hope to, accomplish with my work mode in terms of bringing the solution that is so sorely needed to the care sector, carers, clients, everybody. So thank you again for joining us today. And I guess I'll leave it on that note.
thank you for giving me the opportunity to speak about my work mode, and to share the ideas with the wider audience.
Oh, yeah, no problem. It's hopefully we can have you back to talk about some more care sector related questions and topics. I'm sure you'd be a great insight and source of information for these things. All right. Well,
Absolutely, I'll be happy to come and talk to you about any news, or just generally about the sector as well.
okay. Thank you. Bye-bye.
Bye.
Thanks for tuning in to Let's Talk About Health and Social Care with My Work Mode. Do you have a topic you'd like to talk about when it comes to health and social care? Or do you know someone who'd be a great guest for our show? Shoot us a message at contact@myworkmode.com to connect. Follow us on Facebook and Instagram at MyWorkMode for updates, news, and special offers. Thanks again, and see you next time.